Human hands are the #1 source of transmitted pathogens, which may cause healthcare-associated infections in healthcare settings. According to the CDC, 1.7 million American patients are infected with HAIs every year, and 99,000 of these patients die as a result. While hand hygiene is the best way to prevent infections from spreading, hand hygiene procedures are only followed 40% of the time on average. Proper hand hygiene is the responsibility of each and every person in a healthcare setting, and it helps protect our patients and our staff from the risks of HAIs. Hand hygiene is important for 3 reasons. First, it helps prevent cross-contamination between the patient zone and areas such as corridors and public spaces. Hospital patients shed microorganisms onto surfaces such as bed rails and furniture, where they can easily be picked up and spread to other areas. These pathogens can survive on environmental surfaces for extended periods of time, making hand hygiene critical to prevent transmission. Second, proper hand hygiene also helps prevent infections in compromised areas of a patient's body, such as mucous membranes, open wounds, and insertion sites for invasive devices such as IVs and urinary catheters. Hand hygiene can help ensure germs on your hands don't colonize in these vulnerable areas. Third, hand hygiene also helps prevent the transmission of pathogens to healthcare workers like you. Learning when and how to properly perform hand hygiene can help minimize these risks. According to the World Health Organization and the Centers for Disease Control, it's critical to perform hand hygiene at the correct moments in the patient care process. To prevent cross-transmission from the environment to a patient or from one patient to another, hand hygiene must be performed immediately before touching a patient, before a clean aseptic procedure, after body fluid exposure or risk, after touching the patient and before touching objects outside the patient zone, and after touching patient surroundings, such as monitors or bedside tables, even if there is no direct contact with the patient. And of course, hands should always be washed before and after eating and after using the bathroom. There are 2 recognized techniques for performing hand hygiene: using soap and water and using an alcohol-based hand sanitizer. The use of hand sanitizers is preferred in most clinical situations, as they are quick and effective, ready to use at the point of care, and do not require water. But in these situations, you should wash with soap and water when hands are visibly soiled or dirty, when hands show visible contamination with blood, body fluids, or proteinaceous material, when hands have been exposed to spore-forming organisms such as Clostridium difficile, and after using the bathroom. To be effective, hand hygiene must be performed correctly. When using an alcohol-based hand sanitizer, apply product to the palm of one hand. With a rubbing motion, spread the hand sanitizer evenly, covering all surfaces of both hands, especially fingertips, nails, and in between your fingers. Continue rubbing your hands together until the product is completely dry. When washing with soap and water, wet your hands under a stream of warm water. Apply 1 pump of soap and vigorously rub hands together for at least 15 to 20 seconds. Pay special attention to thumbs, backs of your hands, and in between your fingers. Use the palms of your hands to scrub your fingertips and under your fingernails. Rinse your hands under warm running water. Gently pat skin dry with a disposable paper towel. When hands are dry, turn off the faucet using a paper towel. Hospital-approved lotion can be used when you are done washing your hands to keep skin moisturized and protected. Wash your hands for at least 15 to 20 seconds, not including drying time. The use of gloves is another important part of infection prevention. Remember that wearing gloves does not replace the need for hand hygiene. In fact, hand hygiene should be performed every time you remove your gloves. Using a hand lotion after performing hand hygiene can help prevent dryness and irritation by repairing your skin's protective barrier function. Only use lotions approved for hospital use. To prevent skin irritation, use hospital-approved lotions frequently during work shifts, and follow these tips when washing your hands. Always wet your hands before applying soap. Use warm water instead of hot, and dry hands completely before putting on gloves. Jewelry such as rings or bracelets should not be worn during patient care, since it is difficult to perform proper hand hygiene and they may harbor microorganisms. Fingernails should be kept short, no longer than a 1/4 inch in length, as long fingernails are associated with outbreaks of resistant pathogens. Be sure to review and comply with your facility's policies. Good hand hygiene should be practiced and mastered by each and every member of your healthcare team. Making it a habit is one of the most important ways to protect your health and the health of your patients. Protect every touch, every time, and show you care by washing your hands.